Yes, come on. I'm just inviting the students to come and join. Yes, iPhone. Can you please type your name? Yes. So we have Krishnanta. Krishnanta. Okay, very good. Thank you for responding. Krishnanta. So take your notebooks. We are going to blast it today. One full letter. One full letter. Lot of things we are going to learn. So you can invite your friends. Right. So before we start, I want you to write the problems related to your writing. The main problems you face while writing. Come on. Blast. Pour out your problems, because there is someone who is going to help you out. You can realize that many people are also facing the same problem. I'm not alone in the boat. I'm not the only one drowning. There are many others who are facing the same problem. So what I'm going to do, come on, write down all your problems, any problem, recall all the problems and write down one by one. All your problems, any problem, recall. Write down, there is one point there. Come on. Come on, shoot your problems. Shoot your problems. It should be very dynamic. Otherwise, go and sleep. This is a dynamic platform. Very dynamic platform. And I want every one of you to be dynamic. There is no place for sloth here. No laziness. No being inactive. Yes, we're going to have a series of letters. Right. I'm inviting just some of our friends. In the meantime, you have just 3 minutes. 3 minutes afterwards, we are going to dance the tide. It's going to be a Herculean task. Yes. Come on, write down. In the meantime, I'm going to do a number of things. The name of our patient is Mr. Peter Dunbar. And next, there is one letter for the doctors. You can join that letter also. I'm going to start this series for the other 10 professionals from tomorrow onwards. So I am going to drop out nurses and the doctors, because there are many other people, many other professionals who are neglected. There are no sessions for podiatrists, physiotherapists, dentists. So I want to focus on those areas which nobody else is doing. Because it is injustice. It is injustice because there are doctors, too many doctors. Okay. Business wise or income wise or finance wise, that is different thing. But you know, I'm least bothered about all those things. God is the provider. He gives number of things. I'm proud to announce, I was thinking from the first onwards to do some new batches, because I was just buying a floor above. I already took it, and 3 months, 4 months back, I gave an advance to my flat. I want to share my experience. When you're doing something from the depth of your heart, everything will be fine. So November. Yeah, that time I was in Trivandrum, Kerala. I started my business there. Not business actually, it's training institute. So it was actually multi-purpose. The orientation was diverse. I wanted to give opportunities to some people. I wanted to give education to the people who did not get quality. So the thing is, I don't know what happened. Then this corona outbreak, and it was getting heavy, and you know, then I had to come back to Hyderabad. Temporary full stop. Temporary, I mean comma, not a full stop. I came here. Then I thought I'll take the flat upstairs so that my family will not be disturbed, because I'll be shouting and I'll be blasting, and I'll be even, hitting the doctors and nurses black and blue. Okay, painting them with different things, how to enhance their quality. My family members, they'll say, why are you shouting at them? I said, I'm teaching. This is my style. So any other disturbance, because it is home. So I took upstairs. Why God blesses me, I'm telling you. Really, really, really. Today, it was a massive blow. Massive blow. Why I trust so much, I don't know. I had to give today 5 lakhs of rupees. I already gave 7, and today I had to give 5 lakhs of rupees. I least bothered. Why you are so cool? I did not know where from I'll get. I just said, God gives me. That's it. So my father passed away November, and I put a full stop to that one, and the owner wanted to sell it to somebody else, and he took the key, and he thought, okay, if something comes, I'll return. God, man proposes and God disposes. I told, if it is in my will, if it is God's will, if it is in my portion, if it is in God's will, it will come to me. He will come back and he will hand over the key to me. That's what exactly happened on the 30th of last month. And he reduced 5 lakhs of rupees. God's grace. Said, sir, I don't know why. Many people are asking, but I did not want to give you. I wanted to give you. They are paying, they are ready to pay this much amount, but you can pay and take it, no problem. Because the others were demanding even less than that. They're not ready to pay. So he reduced the amount because I said, whatever you tell me, I'll give. Because God knows things. My wife was asking me, my children were asking me, how are you going to manage these things? How are you going to pay him 5 lakhs today? I said, I don't know. Then I told you, see whatever you want to do, but I will see whatever I was trying this, I was trying that, I was doing all these things. Today my wife called me and said, somebody is ready to give you and you can pay. 5 lakhs, one person gave me just like that. Of course, because no bank will give loan to that house. So I had to take a hand loan. And I know, God knows he will give at the right time. Yes. So why should I bother about anything? I never advertise much because I know when there is quality, automatically people will flock around the quality. That was a proof today. When too many people are coming and joining my group, somebody said, somebody is something nonsense. This is my channel. If any fraudster is there, if he advertises something fake, immediately I'll remove him. My channel is the channel which has 0% of fraudsters. In other channels, you see, leaked papers, that papers, this papers, genuine papers, buy this one, we'll give this one, we'll give this, change the result, that nonsense, this nonsense. Every channel has that. But sometimes I even closed, I was fed up of this nonsense every time somebody is posing. And sometimes some people were posing dirty things also. So I sometimes close it also totally. I will not allow anybody to write on that. Some people ask, why do you want to close? Why should I dirty my because of some stupid fellow? So God will give. Right? I was trying to give lot of sessions to lot of nurses, lot of doctors. But I don't think the doctors and nurses need this quality. Very few people, very few, handful, pick and choose people. They come to me, they pay me, and they study with me. So I give them, actually these are peanuts. Because I used to take 35,000 for doctors and 40,000 for doctors when I was taking on offline in Amritsar. They used to come. And nurses, 25,000. 1 month. 1 month. Thanks to Corona. So I thought, bless everyone. So there are many professions. 10 professions are there. Nobody is teaching them. So I want to shift myself there. Because many times, many people asked, physiotherapists and some other professionals, they asked me, sir, why don't you take some sessions for us? I said, I'm a little bit busy, so I cannot take neither. But now I thought, because I have seen many people, they want to pay money, but they don't want to learn. Every day I want to raise them, alarm, raise an alarm. Come on, come on, come on, come on. Post your, submit your attendance, do one reading, do listening. Every time I have to point out my finger like, come on, do this one, come on, do this one, come on, go. Who do you think I am? Huh? Am I a waiter to put on your plate every time? Come, 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 like this. I'm a teacher, my dear. Know the quality and learn. Okay. So I am going to limit the admissions. I'm going to limit the admissions because I think nurses admissions will be slashed down from 7 admissions to only 3 admissions from now onwards. No 7. Because there are many teachers, they'll go here, they'll go there, they'll jump into that well, they'll jump frogs in the well like that one. Everywhere you're jumping. Okay, sometimes here, sometimes there, no seriousness. So I'm slashing down to 3 only, 3 admissions. That's enough. Those are really genuine, they'll come. And then many free sessions I'm already giving. So that's it. These are also free sessions. You're not paying for these sessions. Nobody is paying for these sessions. You're paying for writing corrections. Only for writing corrections and speaking feedback, not for these lectures. Nobody is paying for these lectures, and nobody gives these lectures also. Well, you get some money, they teach. Otherwise, they correct the letters because they are getting money. And nobody will teach. People are crazy, you think, to teach all these things? Peter sir is crazy. Of course. Because he loves you, no? He loves his teaching more than what he loves you. He loves his teaching. Okay. So he'll try to do the best. So what I'm telling you is daily, only 1 letter I'll give. Regularly, I'm going to give. These are totally free. You need not pay anything for me. But letter corrections, I have to get paid. So now onwards, I'm not going to give you admissions for full course. Only letter corrections I will take. This month, stopped, totally stopped. And next month, I'm going to start speaking corrections. Okay? On a different platform, different style. Some higher level. And then remaining timings, I'm going to cater for other departments. Other departments like physiotherapy, podiatry, okay, dentist, occupational therapist, like that. I'm daily 1 session, daily 1 lecture I'll give for them. That's better, I feel. So, how many of you? Only 9 people. I'm not angry. Sorry, I'm not angry. I'll never be angry with my students. Okay? I'm never angry. I'm never angry. Sadness. See, I'm giving a lecture, only 20 people are coming. Okay? I'm not angry. I'm helpless, my dear. I'm helpless. I'm helpless. I feel very sad. I cook biryani. I cook delicious meal, and my children are not ready to eat. Don't I feel sad? I'm not angry. That's not angry. There's sadness, with a lot of love, affection, patience, and everything. I toiled together for hours together, and nobody's interested to eat because they have work, they have family, they need sleep, they need entertainment, they need that, they need this, they need everything. But they want only result from Simon sir. They don't want to work hard. That's the problem. So I feel very sad. See, once somebody is writing here, in our country, we don't have teachers like you. I'm not a great teacher. I'm a very ordinary teacher. So they never teach free lessons. That's why I joined your class. Somebody else, I don't want to name. Okay, just now they have written. So I love teaching. I love teaching. Okay. And more than that, I love those people who are ready to be very obedient and learn, because my knowledge is passed through you. I am recognized because of you. That is why I work hard. I work hard, maybe almost 18 hours a day. From morning 9 o'clock till night 2 o'clock, I'll be there almost always with you. Yes. And don't worry to come to our country, sir. Okay, you have sent a direct message, so I cannot read it out. Okay, don't worry, sir. You come to our country. Great. The next visit country. Okay, fine. So that's it. So whoever is interested, attend every day. Okay, every day, same time. 1 lecture I'll give. Other than that, I'll be correcting the letters, and you can have subscriptions for your letters. Only subscription for your letters. I'll give you that link for subscription. I'll give you link for subscription. You can join there. Okay. I will not ask you every time, write letter every day. Submit one letter, do one reading, do one listening, do that, do this. Okay. Right? Fine. Now coming to the point, this is the letter. Very good. There was one nurse today. She's from one country, Nigeria, and she's working in another place, Dubai. And she requested me, sir, what is your fees? I said, it is 15,000. Sir, I will join at the end of the month. You know why? I'll get my salary then. I don't want to name that lady. Okay. You can join the free sessions until then. Every day, all the free sessions, whichever you are interested, you can join that time. No problem. But I know that you are really serious. Okay. Now, every day, one lecture. Now, I'm going to ask you one question. My classes are my children. Those who are in my house. Okay. All my lectures are recorded. Okay. All my lectures are recorded. Yes. Thank you, dear. So, all my lectures are recorded. But you know that feel, real teacher is sitting in front of you and teaching something. That feeling is something different than the recorded sessions. That you will not be, motivated. The motivation, that charisma, that magnetism, that, that pull will not be there. Okay. So try to be in the house when the lecture is going on as far as possible. Right. Next one. So Peter Dunbar. Peter Dunbar. This is the name of the patient. Number one, never use the word patient. It is a negative word. It's not a positive word. You have a lot of patience. That is a positive word. But you are a patient, means negative word. Doctor and patient. Teacher, student, both are positive words. Teacher and student, both are positive words. But doctor and patient, doctor is a positive word, patient is a negative word. Okay. Seller, buyer, both are positive. But patient is a negative. No one wants to be called a patient. For example, I am a doctor and your brother is in the bed and I say, bring that patient here. Then you feel like slapping on my face then and there, right away. Why? How dare you call my brother a patient? You useless fellow. That is what I tell. If that is my brother has a name. You can ask me, what is your brother's name? Or you can see the case notes and check his name and say, bring Mr. Lincoln here. You useless fellow, how dare you call my brother a patient? So it's not fine. Nobody is ready to accept. And you'll be getting irritated if anybody calls you loud people a patient. You cannot bear, you'll get that, the blood boils within. Don't use the word patient. What you don't like your people to be called as, don't call the other people. These are called morals and values and formal style. Formal style. Be positive is my blood group. Right. The next one. So, be positive. Everywhere, be positive. 100%. 100%. Right. We are not bothered about any XYZ there. We're not bothered. I'm just talking. Somebody says, ask your conscience. Is that right? That's it. It's informally okay, but not formally right. Okay. So that is why. Then why don't you write every time patient, patient, patient instead of Mr. Peter Dunbar? Then write every time patient. That's the point. He has a beautiful name. So take it. Right. You can write. Nobody is telling no, but the quality is low. The quality is low. Eating rotten tomatoes is okay. You'll get cheap. Okay. Wrinkled tomatoes, small tomatoes, rotten tomatoes, you'll get cheap. Okay. Everything is okay. Everything. Living a useless life also is okay. Failing in the OET is also okay. No problem. Nobody is going to die. Nobody is going to face any problem. Low quality. Low quality. That's it. For example, you see a person who is eating peanuts and throwing on the floor in a railway compartment. You look at him and up and down angrily. At everyone who is throwing like that, when you feel disgusted. But when somebody takes those things and put in a napkin or something and afterwards throws them, you respect that person. He reacts, appreciate. See that person? Person means like that. Quality means like that. That's what. See, that man's a son. What a wonderful nature, what a wonderful behavior, attitude, style, and everything. Like that one you have to get. Okay, Mr. Peter Dunbar. Right. And the case is type 2 diabetes mellitus. Type 2 diabetes mellitus. Type 2 diabetes mellitus. And latest development is signs of diabetic neuropathy. Latest development. Okay, fine. Now, so we are going to learn a lot of new things today, other than what we have learned yesterday. Yesterday was different letter and today is different letter. The style is different, everything different. Okay. Writing. Workshop. This is not just a lecture, this is a workshop because you are going to write number of things. You are going to participate. I'm just going to direct you. It's a workshop. It's writing workshop. Okay. Peter. Okay. Writing workshop. OET. Nursing. This is a nursing based letter. Okay. This is a nursing based letter. Fine. So, what are the ideal number of paragraphs in an OET letter? I'm giving you just 10 seconds. 1, 2, 3, 4, 5, 6, 7. Any one number you write. Ideal number of paragraphs. How many paragraphs do you think there should be? So you can just type there. Yes. So, 14 students have given the response. That means 14 students know, okay, something. Others are just waiting, right? That's good. I'm giving them 5 seconds so that they will come out of their sleep and write something. Okay, so I'll tell you why. So writing, workshop, OET, nursing. Right. 5, 5, 4, 5, 4, 5. Actually, there are 3 main paragraphs and the header and the footer. That means the introduction and the conclusion. Totally 5 paragraphs. Actually, letter is only 3 paragraphs. Letter is only 3 paragraphs. That is the main letter. First one is the welcome and last one is the goodbye. Those are not considered as paragraphs. Just the introduction and last the conclusion. Hello, good morning, sir. How are you? So in the introduction. Okay, let us take a leave. This is the end of the day. Have a nice day. Bye-bye. That's the end. So these are not the main part. The main meeting is the meeting in between. 3 paragraphs only. 3 paragraphs only. That's it. Okay. 3 paragraphs. So 1 plus 3 plus 1. That is it. 1 plus 3 plus 1. These are 3 paragraphs. How can we divide? How are we going to organize these 3 paragraphs is the most important. Because the introduction and the conclusion are baby paragraphs. Half ticket, only half worth. They're not worth much. The introduction has a little bit value. Okay. Right. So so ಈಗ ಬಾಲಿದೆ ಮಮ್ಮಿ ಬಾಲಿದೆ తర్వాత afterwards Oh, I'm sorry. I'm sorry. I'm sorry. I'm sorry. I forgot. Okay. Never use the word patient in the particular sense. Don't call a person as a patient, but use the word patient in the generalized sense. What do you mean by in the generalized sense? Now, in the generalized sense means patients should be taken care of. All the patients must be given food and medication in time. So this is general. Call them generally, no problem. But don't call particular person as a patient. That is what I mean to say. So specific person don't use. Specific person don't use. Right. Next one. Okay. Right. Now, what are the different types of letter? Come on, write down. What are the different types of letter? So what do you know about the different types of letter? We are going to discuss all these letters on a daily basis. On a daily basis, we are going to discuss all these letters. So come on, tell me. Write down, write down. What are the different types of letters? What are the different types of letters? So what I'm doing now, do you know, it is called organization. What fits best where? What fits the best where? So how to make it beautiful? So I'm creating a beautiful slide, so it looks beautiful when you see it. So when somebody reads, what you are writing is not important. What the other person is reading more, the other way around. The tables turned. Turn the tables, topsy-turvy, upside down. Don't look as a person who is writing the letter, but write as if you are the person who is going to read the letter. Then you will do justice. You'll do justice. Doing justice is more important. Writing, any Tom, Dick, and Harry can write. There are 100 nurses in the hospital. Why so and so nurse gets wonderful name and recognition and love and affection? Why certain patients tell, I want that nurse. I don't want this nurse. I want that. They don't say, I don't want this nurse, but they say, I want that nurse. Other nurses are acceptable. But when they say, I don't want this nurse, that means this is that quality. That is the quality of that nurse. Okay. So try to understand that. Try to understand what he's telling there. So be the best. Be the best and second to none. Be the best and second to none. Write down first. Okay. Number 1, rules and regulations. Rule number 1. Write down. Avoid active voice. Avoid active voice. Rule number 1. Avoid active voice. Then what are we? Am I telling you totally avoid active voice as far as possible? When you know that you can use passive voice, then you can use passive voice. Okay? Avoid active voice as far as possible. That's it. Avoid active voice as far as possible. That's it. Avoid. But sometimes you have to use active voice. Use passive voice as far as possible, but avoid active voice as far as possible. So 80% of passive voice and 25% of active voice is okay. But if you can avoid that also, it's wonderful. That also, if you can avoid, it is wonderful. So avoid as far as possible. That is what I'm telling you. Number 2, write down. I'll be giving number of points. Number 2. Afterwards, you ask me, sir, how to teach, learn passive voice. I'll teach you. I'm training you number of sentences. Number 2, avoid personalization. Avoid personalization means avoid personal pronouns. Avoid personal pronouns. Now, what do you mean by these personal pronouns? Personal pronouns are those, okay, personal pronouns are those which are used instead of nouns. What are those personal pronouns? I, we, you, you all, he, she, it, they. Why should you use all these things when I tell even the name is not important? Only one time you write the name. Don't write. Even the name is not important here because you already in the subject only you are telling. If you label the map India, that means everywhere within that map is India only. If you label the map Australia, the entire things, areas, regions in the map belong to that specific country. So try to understand what I'm telling you. So, no need. I, you, we, he, she, it, they. Avoid these things. Avoid personal pronouns. Number 3, avoid repetition. Repetition. What do you mean by repetition? Saying the same thing time and again. Saying the same thing time and again. Blood test was ordered. And in the next sentence, blood test reports arrived. And in the next sentence, the blood test reports revealed. Why 3 times? Why 3 sentences? Club them up together. You know, in that movie Bahubali, he took 3 arrows and shot at a time. Put the 3 arrows together. If you have not seen that movie, Bahubali, go and see there. He teaches the heroine. The hero teaches the heroine how to shoot with the 3 arrows. Earlier, she failed 2 arrows only. Okay, she could not shoot 2 arrows with 1 bow. But this fellow, right in the middle of a battle, he taught her how to shoot 3 arrows at a time. That's it. I don't know how far it is true. Maybe fictitious. Maybe it is true. We don't know. But there are many talented people who do many things. What we cannot do, it cannot be imagined that it is impossible. There are elephants standing on 1 ball without falling down, balancing everything. There are women who are dancing on the ropes. Nothing is impossible in the world. Everything is possible. So try to avoid all these things. Okay. Number 1, avoid active voice. Number 2, avoid personal pronouns. Number 3, avoid repetition. And number 4, avoid commonplace words. What do you mean by commonplace words? The words which can be spoken by, uttered by every Tom, Dick, and Harry. Okay. Sir, why every Tom, Dick, and Harry? That is an idiom. It's an idiom. It means any person in the world. It means any person in the world. A word which any person in the world can use. Then why are you using? Are you any person in the world? No, you are a special person. You are Simon Sir's student. You deserve better results. Any person in the world, that means average person, common person, normal person, usual person. ordinary person, general person, anybody can use. So that means 50%, average. Average. Why do you want to be average when you know that you can use something else? Why don't you bring the words which are hidden, stored at the back of your brain? Bring them forward and shoot them. Okay. There are many people who knows the word simultaneously. I want to ask you, how many of you know the word simultaneously? The word, 1 second, simultaneously. Okay. How many of you do not know? How many of you know, right? Yes. How many of you do not know, right? No. Come on, fast. Hello. Yeah, I'm in the middle of a session. Okay. So what you can do for me is, I want you to take all the medical letters, case notes. Okay. Medical letters. Select the medical letters. Doctors. Okay. Official website. Go to the official website. Collect all the letters and try to see how many sentences are there in active voice. Only 5 letters are there. Medical letters. How many letters are there in active voice? Okay, how many sentences are there? Make them a list and everything. Okay, right? You are going to do some research for me. Okay, right? So from the 5 letters, take all the sentences from paragraph 1 to paragraph 5 and break them into sentences and put them order number 1. Letter number 1, 20 sentences. Letter number 2, 20 sentences. Letter number 3, 20 sentences. I am going to improvise those quality and I am going to publish a book for that. Please do that and send me. Okay. Right? So these many, but how many of you are using every day? 1 minute, finished. There, stop. There, stop. Usage in daily life. At least once in a month, are you using this word simultaneously? Come on, if you are using every day, say yes. If you are not using at least once in a month, say no. Come on, right? What you are looking for? Once in a month, at least you are using it every month, once a simultaneously word. Then you write yes. Once in a month at least. Otherwise, say no. Now you understand what is here and what is here. Forehead, the word at the forehead and the word at the back. It's there in the storehouse. Even in library, the main books which are read regularly, the journals, the weeklies, the dailies, will be there in the front. And the textbooks will be there in the front. And other books will be there in the storage, in the storehouse. When you need it, you go and bring it. If you are so powerful, so patient, so with that thirst for knowledge, you will go and read those books. So bring those words from the back and try to put them in your speech. And for example, I'm going to ask you one word. Yeah. Now what I'm asking you is, I have to invite some students, I forgot. Okay. All right. So I have 25 students. That's enough for me who are ready to listen. Simply coming and going, these people. No worries. Okay. So now what I'm asking is, I'm going to give you one word. And you have to find a substitute for that word. Write as many words as possible for this one. Come on. Sorry. It went to one person in the world. Okay. Think about. Come on, shoot. The word good. Anybody can use that word. Good. For example, if a patient comes and tells you, I my condition is good. Wow. Wow. That's wonderful. I did not expect that much improvement so fast. That's the difference. But what many doctors say, my condition, okay. If the patient says, now I am good, sir, my condition improved. Okay. There is not even a smile in his face. There is no affection towards the patient. Nowadays, many people only see what is going into their pockets. There is no dear. There is no love, and there is no affection. There is no kindness. Okay. There is no burning thirst to serve the patient. If a patient says, good, that's really wonderful. That's the difference. You feel, then the patient will be very happy. Oh, if I'm good, doctor is happy. For example, the patient is saying good. And say, okay. That means now my condition. So the doctor is thinking what? I will not get money from this patient anymore because he's good. So he's sad. Maybe. So try to understand. Okay. There was one doctor, okay. My sister. I don't want to name the hospital. I don't want to name the doctor. But what happened? The real situation. 25 years ago. 25, no, 22 years back. Before 2000. My sister. Okay. So she was delivering a child. And the doctor was out. And the doctor said, everything get ready. Operation table also ready. Everything ready. And I'm coming in 20 minutes. But fortunately for my sister and unfortunately for the doctor, there was a safe delivery. Normal delivery. And the doctor came and said, oh, why are you in a hurry? That means, that there was some sort of pain in it. If I had done the operation, I would have got some more bucks. That's. He was smiling and he's laughing and telling. But try to understand what the intent is prior to the content. What is there in your heart comes before your words. That is called love, affection, kindness, politeness, all the good things clubbed together, rounded into a ball and coming in front of you. That is what you have to give to the patient. Okay. A number of words coming there. Great, better, wonderful, absolutely, well. Okay. That sounds good. You say, how does that sound? But you're not saying, that sounds good. That sounds wonderful. Well, sir, I improved. My condition is good. I took the medication. That sounds wonderful. Not how does that sound? How does that sound? You ask your patient in your speaking sessions. But why don't you tell like this one? That sounds wonderful. That's really amazing. I really appreciate you. What not? If you have love for the patient, you can do miracles. Half of the patient's sickness will be treated by your love and affection, even before the patient takes medication, because he trusts you that you're going to do something good for him. Because of that trust, half of his problem will be solved. And do you know? The patients can understand whether you are treating or cheating. Okay. So try to use the best for it. Fine. Next, the fourth one is avoid commonplace words. Okay, avoid commonplace. Now is the time for giving these 4 words for you. Okay, the 4 words are not the 4. Yeah, the 4 things are the 4 rules. Avoid. This is called constructive criticism. The 4 pillars of your letter. The 4 pillars of your letter. Number 1, avoid active voice. By mistake, I have written here. Okay. Avoid active voice. I wanted to write use passive voice, then afterwards I wanted to change it to avoid active voice, something like that. Maybe I wrote this one, but I missed that. So avoid active voice in the first place. So that means what? Use passive voice. These are called do's and don'ts. Don'ts are more powerful than do's. For example, if you come to my house, I'll tell you do this and don't do this. My house, this letter is my house now. And I tell you, do this and don't do this. I will not be angry when I do not do those things which I tell you to do. But I will definitely be angry when you do those things which I tell you don't do. See that? And I'll be on fire. I'll not spare you. If you do not do what I tell you to do, no problem. At least stay neutral. But when I said don't do certain things and you still do those things, I'll blast you. That is what you tell when somebody comes into your house. Be careful. These don'ts are more powerful than do's. They will destroy you. Okay? They will destroy you. Be careful. So these are the points which you have to remember. These are the 4 basic tenets of OET letter. If you can realize that, you will add quality to your letter. Yes, coming. Okay. So I see in many advertisements, there was a movie also. In that movie, they gave an advertisement in it. Add color to your life. Add color to your life. I say add quality to your letter. Just playing with words. Playing with words. Add color to your life. Add quality to your letter. That's it. So if you want to add quality to your letter, do these 4 different things. Okay. These are the 4 things which are very, very important. Add quality to your letter. Okay. Now there are some unnecessary trouble things. Okay, 1. Yeah. So that we eliminated. Fine. Next. Now let us see. Peter Dunbar and type 2 diabetes mellitus. We have two different things here. Type 2 diabetes mellitus. That is the problem. Okay, that is the case. That is the case. Diabetes mellitus is the case. Okay, fine. Okay. So this is Peter Dunbar, Mr. Peter Dunbar. Type 2 diabetes mellitus. Peter Dunbar, type 2 diabetes mellitus. Okay. Fine. Now, what is the main problem is this? Diabetic neuropathy is an offshoot. It's a deeper problem. Cancer, lung cancer. Cancer, throat cancer. Cancer, skin cancer. So different types of cancers. Okay. So cancer is the main. Okay. Like that. So diabetes mellitus and diabetic neuropathy. So that's the later offshoot. Right. Peter Dunbar. Okay, fine. Now, I want you to write one sentence using these two things. Peter Dunbar and type 2 diabetes mellitus. Peter Dunbar and type 2 diabetes mellitus. I want you to write one sentence. I'm just giving you 30 seconds and check and cross-check. Not even single spelling mistake should be there. I should say, no mistake. Like that you have to write. Capital letters in the beginning, full stop in the end, commas wherever needed, and whatever. I want you to write these two things and write whatever you want, but these two things must be there. Peter Dunbar and type 2 diabetes mellitus. No mistake should be there. Peter Dunbar, type 2 diabetes mellitus. Okay. Right. "30 seconds. See that not even a single mistake is there. Take care. I'm teaching you those things which will make you get a 400 plus. I'm not trying for 350. I'm trying for 400 plus. You'll definitely get. Okay. If you want to check whether the room is clean or not, go to the corners of the room and under the chairs and sofas. Then you can decide whether the room is perfect or not. So these are the corners which nobody will notice. So that is what I'm teaching you, so that you will never lose marks. even by mistake. Mr. Peter Dunbar and type 2 diabetes mellitus. One sentence. And that sentence should be perfect, as perfect as possible. Because there are 20 people will write in 20 different styles. Write only one sentence. Focus on only one sentence. Right. So that's the time up. 15 sentences. Very good. Mr. Peter Dunbar has been diagnosed with type 2 diabetes mellitus. Sharmili Asanti. There is no need to write capital D and capital M for diabetes mellitus. I am referring Mr. Peter Dunbar, who has had type 2 diabetes mellitus. See, different people will write at different types. Dr. Sally Almabashir. Okay, good. Good. Then, Mr. Peter Dunbar is suffering from type 2 diabetes mellitus. What do you mean by is suffering? Who is this? Typhotomy. Is suffering. That means now, at this moment, only he has been suffering. But never use the word suffer. Don't use the word suffer. Avoid that word. It's not very good word like patient. Okay. You can say something else. Don't use the word suffer. Okay. Don't use the word suffer. Avoid that word. Yeah. Capital letter, full stop, everyone. Wow. That's great. That's really great. I like everyone. Swati to everyone. Swati. Before full stop, there should not be any space. Before full stop, no space. After full stop, space, but not before full stop. Very good. Very good. Everybody's following. Wonderful. Wonderful. I like. Mr. Peter Diana Sheba. Mr. Peter Dunbar, comma is not necessary there. Mr. Peter Dunbar was diagnosed with type 2 diabetes mellitus. It's a single sentence and no need to put comma there. Okay. Now, can you write this one? Okay. Without using Peter Dunbar? Yes. Type 2 diabetes mellitus was diagnosed. Finished. Why do you want to use Peter Dunbar? What is the reason? We know that this is about Peter Dunbar only. Okay. So not at all required. Fine. Okay. Right. Next. Very good. I like it. I like it. Everyone is participating. Almost 18 to 20 people have participated. I like it. Really like it. Sitara Jayatunga. What is the spelling of sins? You know it. It's a mistake. It's okay. Mistakes are common. Mistakes are common. Okay. It's human to err, but to forgive divine. That means you forgive your mistakes and learn, check and cross check. So you copy that sentence and rewrite it with correct spelling. Okay. Sins. S. Okay. I and N were changed positions. Fine. So be careful. Right. I am referring Mr. Dunbar. Yeah, I am referring Mr. Dunbar, who has had type 2 diabetes mellitus. Okay. I am referring. Who is important, Dr. Sally? Is it you or Mr. Dunbar? Only you can refer Mr. Dunbar to somebody? No other doctor can refer? That means you are the only one person in the world who can refer? No, no. Anybody can, any other doctor can do. If I am a doctor and I am in your position, I have got a certificate and I am a doctor in your hospital, in your place, then can I not refer? Anybody who is in your place as a doctor, by profession and by experience, anybody can refer. No? Then why do you bring yourself into the picture? What is this I doing here? Avoid. So say, Mr. Dunbar, comma, who has had a type 2 diabetes mellitus, comma, is being referred. Okay. Mr. Peter Dunbar, who has had a type 2 diabetes mellitus, is being referred for XYZ. That is, so you can write like that. That's finished. And next thing, diagnosed. Mr. Peter Dunbar, is it was diagnosed or has been diagnosed? Now, Mr. Peter Dunbar was diagnosed means past tense, has been diagnosed means present tense. Now you tell what is in your mind. What time is there in your mind? 2 days ago, or 2 days back, or 1 week back, or 10 months back, or 2 years back, or 6 years back, or 10 years back. So this is past tense. Yesterday also is past tense. If in your mind, for example, today is Wednesday. Wednesday. Day before yesterday was Monday. Monday, diagnosed. Today, you are talking. Will you say, day before yesterday he was diagnosed, or this week he has been diagnosed? What will you say? Now, I'm giving you the options. Option number 1. What will an average person think? Okay. On Monday, Mr. Dunbar was diagnosed. Or this week, comma, Mr. Dunbar has been diagnosed. Now, if you are an average person, what will you think? 1 or 2? Come on. Sorry. 1 or 2. Come on, hit the button. What will come into your mind? Past tense or present perfect tense? On Monday you will think, or this week you will think? Come on, hit the button fast. 1 or 2. Which is the most likely thought you will get? In your mind, what will come? Day before yesterday, or Monday, or 13th? Or this week? This week means Monday will fall this week only. It is not last week. So it will become present perfect. So if you are using present perfect, you have to say this week Mr. Dunbar has been, sorry, Dunbar, spelling mistake. Okay. Mr. Dunbar has been diagnosed. But nobody will get into his mind that it is present tense. So it is a common, 90% of the people, 99% of the people will think as a days, Monday, on Monday. That means not today. Monday is 2 days before, 2 days ago, before 2 years. So anybody will divide this as days, not weeks. Will not consider week. You will say, yesterday I went to my friend. You will not say, this week I went to my friend. Try to understand. So now, which is best to use? So simple, number one, simple past, or number two, present perfect. Now, which is the most ideal? Which is the most ideal option? Come on, tell me. Come on, all of you, give your voice. I'm not the best teacher. You are the best learners. Yeah. Which is the most ideal option? Come on, hit the button, one or two. What do you think? Now you tell me which you want to write based after this discussion. I'm waiting for your number. Yeah, there is one student who wants to write. Yes, Okoye Jennifer. Very good. Right. When I am telling you this one, I am noticing whether it has gone into your mind. The time factor. Time factor has gone into your mind or not? The time is divided into three parts. I'm teaching you tense now. I'm teaching you tense. Nobody will teach you tense. I'm teaching you tense. If you say, then I will teach you. If you don't want to say, that means you did not understand this only. Then how can I teach you tense? If you don't understand this simple logic, then how can I teach you tense? If you say two also, it's okay. At least you are ready to listen. That means you're obedient. So if you're obedient, I can teach you. If you're not obedient, you don't want even to write one or two, then how can I teach you? Okay. So what I mean to say is, time is divided into three parts. It is based on what is there on your mind. If you think day, then today is present tense, yesterday is past tense, tomorrow is future tense. Day, today, yesterday, and tomorrow. That's all. Today, yesterday, and tomorrow. Today is present, yesterday and before past, tomorrow and after future. That's all. So there is nothing called present, past, and future. There is no standard time division. Mind you, it is your mind which divides time into three parts: past, present, and future. If you say, whatever you say in present tense, I can tell in past tense. Whatever you say in past tense, I can still tell in present tense. There is no problem with it. Okay, anything, whichever you say in past tense, I can tell in present tense. Whichever you tell in present tense, I can tell in past tense. Today, you will say, how is it possible, sir? Today morning, okay. You say like this. One hour back, I read a story. Today, I have read a story. What's wrong? What's wrong in that? I'm least bothered about 1 hour or 2 hours or 3 hours. I said today. Today, I have read a story. That means in my mind, hour is not important. Day is important. But in your mind, hour is important. So hour, you are using past tense 1 hour ago. But I'm telling today, I have read a story. Finished. So time depends on your mental, calculations. So there is no specific present, past, and future. Okay. Last week, I went to Mumbai. This month, I went to Mumbai. Okay. So that is what it is. This month, I have gone to Mumbai. Last a week, I went to Mumbai. This month, I have gone to Mumbai. That's it. So, remember that. So, time. So, whatever comes in your mind, reason properly and write the tense. Okay. And see which is the most common usage. I told you. On Monday. On Monday means 2 days back. Today is Wednesday. Finished, past tense. Okay. Nobody will say this week he was diagnosed. But sometimes it is told. Okay. There is a reasons also. But that time you can use. No problem. That is also right. But which is more common, you use that one. That is what I'm telling you. Fine. Next. So the 4 things to avoid I have given you. Now coming to the point. See, I have already given you the classification here. Okay. Right. Yeah. So now the letter has 7 components. The address, the date, the salutation, the subject, the letter body, the closing remarks, and the signature or the sender's particulars. Okay. So 7 components. These are the 7 components you are going to use. And I have told you all these things yesterday, how you are going to write. I'm just going to show you roughly. Okay. Now, first one. Okay, you will be writing about this. The address. Address will be here. The address is write a letter to the community health nurse in Centerville. The community nurse in Centerville. And address the letter to community health nurse Eastern Community Health Center, then 456 East Street, then Centerville. So community health nurse, Eastern Community Health Center, 456 East Street, Centerville. 4 lines are there. So write these 4 lines. Come on, write down. Write down in the chat box. With capital letters as they are. Community health nurse, first line. Eastern Community Health Center, second line. 456 East Street, third line. Centerville, fourth line. Be careful, capital letters. That's it. So the address, the name, the designation, the hospital or the clinic, the street, the town, and the city. Yes. Everyone should get above 400 this time. If you want to score 400, be ready for the evening session. Yes. No need to put commas. Come on, come on, come on. Write first, then write second line, then write third line, then write fourth line. No problem. At least you will be learning spellings. You will be learning what is coming next, how it is. Come on, come on. Active, active, active. So those who are participating, everything, okay, they will be made into a separate group. I'll see for 3 days. Then I'll make them a separate session. And I'll select 24 students after 3 days. And I'll give them top 30 sessions, daily one writing. Yeah. Now next one. Next, all of you. Okay. You, all of you have to submit this letter after the session before you sleep without fail. I'll give you 1 hour and you have to submit. And all these letters will be given correction. Yeah. How many? Because I'm giving you 400 plus quality today. How many of you will submit? Write your name. Write your first name and second name. Whether you're a doctor or a nurse, that is not my problem. Okay. Come on, write down. Okay. Yes, next. Come on, come on. I'm giving you 10 seconds more. Write down. Don't write, I will submit, sir. Write your name. Write your name. Only those whose names are there, I will take the name. And Smita Kanta, take all these names, write the names on the piece of paper and say, or type them in afterwards, type them. Okay. And send me separately. Smita Kanta, it is your work. Say yes, sir. Very good. Thank you. Lovely girl. Yeah. Write down fast, fast, fast. I was actually thinking of reducing the fees because more people will come. Okay. 1, 2, 3, 4. Yeah. Now next one. Yeah, I have already shared in the Telegram channel. You can take it from there because I cannot send everyone personally. Okay, it is there in the official, this one also. Not only that one, I'll give you the link for that one. You can take it from there directly. Even the, yeah, here it is. Okay. See here, this one. So with the case notes, which paragraph, what paragraph, everything is there. Okay. WhatsApp, there are 250 groups. So which group I should send? I don't know. One person is from one group, another person is from another group. So mostly, okay, I will share it in WhatsApp, no problem. Okay, and I will share it on my status also. Okay, copy image. Okay, I'll post it in WhatsApp. Again, I have to get it from WhatsApp. Okay. You can take directly from Telegram channel. Okay, I'm giving it in WhatsApp. Mega group. That is the first page. This is relevant case notes, all circled and underlined, which is important, which is not important. The next one is second page. Okay. I'll also send it to my status and you can take it from my status also. Yes. Okay. So that is the first page. And this is the second page. Okay, fine. So here, these are the 7 components of the letter. And this is the address, the name, the designation, the hospital or the clinic, the street, the town or the city. The next one, this is the writing task. From the writing task, you will get, okay, Community Health Nurse, Eastern Community Health Center, 456 East Street, Centerville. Okay. So now you can see there. Is the room locked or what? No. Okay. Okay. So, Nimi Francis entered the room. Okay, that was that day. I was thinking, where is this girl? Okay. So you see how it was taken. The community health nurse, Eastern Community Health Center, 456 East Street, Centerville. So that's it. So you have to write like this, 4 lines. Next one, the date. The most appropriate method or the official format should be like this. First the address, then the date, not the date and the address. Okay, that's okay, but it's not okay, formal. Okay, which is accepted format. So now let us see where is the date. For the date, you will go here. This is the last visit. And today's date is 22nd January. Yeah. (22nd January). And this is 22nd January. So I'm just giving you a focus. Okay. So 22nd January. So it is JAN. Don't write as it is. Write January. Full. Remember that. Remember to write in full. Okay. So 22nd January 2019. Officially accepted format. Then next one, third one. Salutation. Salutation, from where will you take? From the first line you take. The community health nurse, the community health nurse. First line, last word, nurse. Then add a dear to it. So you'll take from here, nurse. Don't write community, dear community health nurse. No need. Dear nurse. That's enough. Dear nurse. Remember that. So the last word, nurse. And put a dear in front of that. That's enough. Okay. So take this nurse and put a dear nurse. If it is doctor, dear doctor. Okay. Manager, dear sir, dear madam, whatever. And if it is name of the person is given, Dr. Abraham Lincoln, dear Mr. Lincoln, dear Dr. Lincoln, Dr. Abraham Lincoln. So dear Dr. Lincoln. If it is Mr. Abraham Lincoln, then dear Mr. Lincoln. So Mr. or Doctor or Miss or whatever it is called title. And Lincoln is the second name, not the first name. Don't use the first name. Use the second name. Okay. And because you used there, what name is not given? It is nurse. Profession is given. Person is not given. Profession is given. So what you are supposed to do? So if the name is given, use yours sincerely. And name is not given, use faithfully. You have to use faithfully. Yours faithfully. Faithfully is important because the name is not provided. Name of the nurse is not given. The next one. If the name is given, dear Miss Lucy. Then sincerely. Sincerely. Okay. Sincerely. Then next. Just because of this. So patient details now. Mr. Peter Dunbar, 18/3/1932. So those details we have taken here, the subject or the reference line, the regarding line or the subject. Patient details, name, Mr. Peter Dunbar, date of birth, 18/3/1932. So regarding Mr. Peter Dunbar, date of birth, 18 March 1932, or regarding Mr. Peter Dunbar, aged 87. Okay. So here, if a date of birth is given and age is given, both are given, then you write a date of birth. Only date of birth is given, write a date of birth. Only age is given, then write age. Both are correct. But date of birth is more prominent. Now there are three options. They will give date of birth, or they'll give age, or they'll give both. If date of birth is given, write a date of birth. If both are given, write a date of birth. If date of birth is not given and age is given, then write age. That's it. But these are the best possible forms. Don't try to do nonsense things. Regarding Mr. Peter Dunbar, an 87-year-old teacher. Beating around the bush. Nonsense. Don't show as if you are great. Be simple, but quality. This is what is quality. Okay. What is quality is keep it simple, stupid. That means who talks too much is a stupid. Precise. Next one, the last one is the signature. You are the nurse in a community health center. A patient you have been monitoring is moving to another city to live with his daughter. You remember that? So he's moving to another city. Okay. Now he is in your city. So now you have to check that one. Which city is it? That one we missed there. Now he is moving to Centerville. Okay. City Hospital, Newtown. So you are in Newtown. So you are in Newtown. From Newtown to Centerville he is going. So this city hospital is in Newtown and your community health center also is in Newtown. You have to find out this Newtown is here. And you are a nurse. And you are working in a community health center. And a patient you have been monitoring is moving from Newtown to Centerville. See how it matches from the beginning to the ending. So he is moving to Centerville from Newtown, and you are a nurse working in Newtown, and you are working in a community health center. So these are the three things: nurse, community health center, Newtown. The third one we missed there. Okay, nurse, community health center, Newtown. From here, community health center and nurse, only two things are there. Newtown is there in the middle of the case notes. Right. Precious Sibanda, right? Yes, capital letter. So written small letter. Okay. First letter should be always capital letter. If you don't know how to write your name only capital letter, I don't think you don't know. You know it, but you just wrote like that. So how can you not forget capital letter for the patient's name? Be careful. Make it a habit. Write it again. So next one. Now the letter, the body. The introduction, the urgent or the latest component, the primary or the urgent or the, if it is an urgent letter, okay, the latest one or the urgent one. And if not urgent, then it is primary problem. And in the second paragraph, the secondary or the personal component. Personal component. What is personal component? Personal history, social history, family history, medical history, all histories. Okay. Personal, social, medical, and family. Personal, medical, social, and family. All these four histories. Right. So, third paragraph, main body paragraph, D. The plan for the ongoing activity. So what next? What next? Primary, urgent, latest component, the problem in the past. And secondary, personal component, the present. Social history, medical history, continuing, present. Okay. All is also a history now. It was in the past, but it's a history now. The next, last paragraph is the conclusion. Okay. Right. Now in the introduction, you are going to write these things. The patient, the condition, the diagnosis, the symptoms, and the purpose of the letter. Why you are sending this patient? You are sending this patient, why? What is the condition? What is the diagnosis? What are the symptoms? Something. The name of the patient. Okay. Now let us see what is the purpose will be here. Ongoing monitoring here and appropriate management. Ongoing monitoring and appropriate management. What management? Management of diet. So then exercise, then medication, okay, diet, and medication. And what all? Okay. So this is ongoing monitoring and appropriate management. So needs. So here it is. Patient needs. That means you have to manage his needs and you have to monitor. You know. One second. So huh? Bandage. Turmeric. So so sorry for the interruption. Okay. Now, from where you will get this information is from here. You are requesting ongoing monitoring. So that you have to write. He requires. So, Mr. Peter Dunbar requires ongoing monitoring and appropriate management. Write down. One of you write down. Yeah, when we go to the body, I will tell you what are the secondary and what are the tertiary. Yeah, we are just in the introduction only. So he requires ongoing monitoring and appropriate management. Mr. Peter Dunbar was diagnosed with type 2 diabetes mellitus. So Mr. Peter Dunbar was diagnosed with type 2 diabetes mellitus. That is one sentence which you have already written. Next sentence number 2. Passive voice of this one. I'm giving you 30 seconds. Come on, change it into passive voice. This is already passive voice. This is already passive voice. What is the hero of this sentence? The hero of this sentence is not Mr. Peter Dunbar. Mr. Peter Dunbar is the hero of the entire letter. He is an emperor. Don't make him, degrade him as a king. What is the most important thing in this letter? The doctor diagnosed Mr. Peter Dunbar with type 2 diabetes mellitus. So the doctor is eliminated. Active voice is gone already. This is already passive voice. There is another type of passive voice where Mr. Peter Dunbar can be eliminated. Come on, write down. If you learn today's lecture, you can write any type of letter. That to classy. Come on, write down. All of you. So this sentence, change it into remove Mr. Peter Dunbar. How to remove Mr. Peter Dunbar? I am teaching you here. For example, if the Prime Minister comes to a state, if the President of America goes to a particular state and becomes the governor of the state, then who will rule the country? This law, this normal common sense thing, people forget. Mr. Peter Dunbar is the emperor of the country. That means the entire letter. Not only this sentence, not only this paragraph, he is the hero of the entire letter. Then why do you want to make him again the hero of an ordinary sentence? The hero of this sentence is something else. I'm checking anybody can write. I'll see how many can write correct sentence. See, still everybody is writing has been diagnosed. I don't know why. Type 2 diabetes has been diagnosed. Why has been? Where is type 2? T capital letter not there in the beginning of the sentence. Diagnosed with type 2 diabetes mellitus. It is an incomplete sentence. I want a complete sentence. Type 2 diabetes mellitus was diagnosed. That is right. How to avoid? We don't want we don't want Mr. Peter Dunbar again and again and again and again. Your friend comes to your house, you say, come in. Because you know that you know his name, he knows you. Only one person is there. Why do you want to say, my dear friend, come? That is overaction. My dear friend, Abraham, come. Lincoln, come. Abraham Lincoln, come. This is exaggeration. It's dramatism. Okay, dramatic. Drama. Overaction. Okay, too much. Minimize that. Okay. Type 2 diabetes mellitus was diagnosed. Afterwards, you decide how to use it or not. Okay, now the second sentence is, Mr. Peter Dunbar requires ongoing monitoring and appropriate management. Mr. Peter Dunbar requires ongoing monitoring and appropriate management. Okay. Now I told you avoid four things. Then there is another thing which you have to avoid. I forgot to tell you. Now only it struck me. You should avoid copying the words from the case notes. That is the fifth pillar, the central pillar. No, the central pillar is avoiding active voice, the main one. Avoid copying the words from the case notes. Yeah. So avoid copying the words from the case notes. Right. So don't write the words which are already there in the case notes. Okay. They are not going to add even an ounce of value. So don't do that. Right. These are the 5 things that you are supposed to avoid. So now ongoing monitoring. So you can say regular supervision or regular observation. Ongoing, regular, or continuing, or continuous. Don't write continued. Continued word is restricted, avoided, prohibited. So continuous monitoring. So monitoring, supervision, observation. Write down the words. Write down the words. Just listening will not help you. Keep your notes already next to you. All these words which I am telling you to write them. They will go into your letter. 100%. I got the list of students. So these students can attend tomorrow's session. Esther, Vijnana Jyoti, D. Swati, Abhi, Elizabeth, Smita, Kanta, Kausar, Chintu, Jennifer, Saranga, Sally, Moby, Jubil, and Soki, Sharmili, Lidol, Sitara. These are the list of 16 names I got. Others did not write. That means they don't want to attend tomorrow's session and the next sessions. Very good. No problem. No problem. Only these 16 students, because they have given their names. Okay, if your name I did not read, once again I am reading. Okay. Esther, Vijnana Jyoti, Swati, Elizabeth, Smita, Kausar, Jabin, Jintu, Jennifer, Saranga, Sally, Moby, Jubil, and Soki, Sharmili, Lidol, Sitara. Out of these, regular students definitely can attend every session from tomorrow onwards till the 30 sessions end. Today only second letter. So I'm going to take another 28 letters continuously every day. So regular students can attend all the 28 letters, but the visitors can attend tomorrow's session. Tomorrow's session, because they are not registered regular students, so they are just guests. So we are honoring them to attend tomorrow's session. And if they attend tomorrow's session, they can attend one more session day after tomorrow's session. Afterwards, they have to register. So 30 letters. Fine. And those who register will get the daily correction also. Okay. You have to take the subscription. Fine. And for the visitors, letters will not be corrected. Only 1 or 2 or 3 maximum letters will be corrected. First 1, 2, 3 letters according to their attendance. Next. So if still anybody is there, you can write your names first. Blessing Tem is missed, it seems. Blessing Temiled. Okay. So if anybody's name is missing, okay, you can write now if you're really serious. So only these people will be getting the link tomorrow. Not everyone. Only these names which I am reading, those names will be there. Okay, not everyone. Others, I'm sorry. Right. Next one. That was the Mr. Peter Dunbar requires ongoing monitoring and appropriate management. Now change this one. Change this one into passive voice. This is not passive voice. Again, in this sentence, Peter Dunbar is becoming the hero. Why should Mr. Peter Dunbar? There are two heroes, twin brothers. Twin brothers. So those twin brothers are heroes here, twin heroes in this sentence. Okay, those two heroes you bring forward before the verb. Come on, write down. Write down the passive form. So this is the first one. First sentence. Sentence number 1. Now we are moving to sentence number 2. Yeah, how many of you are writing? I'm going to check your sentences. Okay, 8 students have given the answer. Let me see. Continuous observation and relevant guidance to be given. Yeah, very nice. Regular observation and necessary assistants are required. So you can write any way you want. So this is the second sentence. Mr. Peter Dunbar requires ongoing. Don't worry, you are learning the best. You are having mother's lovely meal. I am your mother and I am cooking for you. Okay. And many people want to eat from the roadside. Okay, hawkers and vendors ultimately end up with spoiling the stomach, upsetting, stomach upset. We are having a lovely meal, delicious. Mother cooks with love and affection because children's good health is mother's glory. So in the same way, the students' results are additional feathers in the cap of the teacher. I'm not doing you any favor, actually. I'm not doing you any favor. I'm doing a favor to myself because if I teach you properly, you will get good results and you will take my name to all your friends. When they ask you, how did you get this result? Who taught you? There is one Mr. Simon, sir. He's very mad. He will teach you. Okay. He'll make you learn. You will tell them. You will be a witness. You will give a testimony to them saying that. Okay. That is called word of mouth. So you will spread the word of mouth on my behalf. No other advertisement I need. That is what I get. Today, one girl, what's her name? Sitara Jetunga from Muscat. She brought another friend. What is the name? I don't remember. Shermili Asanti on the platform. That is word of mouth. That is word of mouth. So one person will pass on the information to the other person. Ongoing supervision and adequate management is being required. Wonderful. Azubike. Azubuike. Better I call you Elizabeth. Lithol Ranyali, why did you not start with capital letter? And Soke, why did you not start with capital letter? Swati, why did you not start with capital letter? Why? 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 Do you want somebody to tell you that you have to start a sentence with a capital letter? You people have learned from the KG to PG till now. You have learned so many things, so many steps you have passed. And now I have to tell you what you should have learned in the KG. Don't say typing mistakes, sir. I forgot, sir. All these things. Don't tell. Huh? Have to be very careful. I don't need any sorries. I don't want you to tell sorry to anybody in the world. Never say sorry again. Try to check before submission. I don't want sorry. I know you people will say sorry. That's why I told. I was looking there. I know I don't want your sorries. Keep all your sorries in your pocket. They will be useful somewhere else. Tell to yourself. Okay. I don't expect sorries from my children. I don't want my children to say sorry to me. I forgive them even before they tell sorry. Okay. I want my children to be the best. Number one. Okay. Next. Very good. Very good. You are doing wonderful job. You're doing regular observation and necessary assistance are required. Now join these two sentences into one sentence. Join these two sentences into one sentence. Oh, you think I'll leave you? I'll blast you. These are two sentences. How will I do this? Okay. Okay. There you are. Now add these two sentences and join. Make one main clause and make one subordinate clause. Main clause and subordinate clause. Subordinate clause use who. Mr. Peter Dunbar, who? Do you know that type 2 diabetes is the case? Do you know that type 2 diabetes mellitus is more important? So bring it forward. Type 2 diabetes mellitus. Like that also you can write. Type 2 diabetes mellitus was diagnosed. Okay. Mr. Peter Dunbar, who was diagnosed? Type 2 diabetes diagnosed. Type 2 diabetes mellitus, which was diagnosed, or Mr. Peter Dunbar, who was diagnosed, or type 2 diabetes, which was diagnosed. Check whichever is possible. Not everything is suitable. Mr. Peter Dunbar. Come on, write down. Only 2 students have written the sentence. How to join these 2 sentences? Yes, 3 students. Mr. Peter Dunbar, who was diagnosed with type 2 diabetes mellitus, requires continuous observation and necessary assistance. Where is the commas? 2 commas are required. Missing. After Peter Dunbar and after mellitus. Now, my sentence, if I write, it will be like this. Ongoing monitoring and appropriate management are required for Mr. Peter Dunbar, who was diagnosed with a double passive. Awesome. Ongoing monitoring and appropriate management are required for Mr. Peter Dunbar, who was diagnosed with type 2 diabetes mellitus. Awesome sentence. Nobody will even think of that one. Peter Dunbar is not important. Purpose of the letter is important. What is the purpose of the letter? Ongoing monitoring and appropriate management. Why don't you bring that one for? You are writing this. Purpose is very important. Are required. What are required? What is your purpose? These 2 are the purpose. Ongoing monitoring and appropriate. That is the reason why you are writing the letter. They are the heroes. They are the purpose of it. Nobody writes like that. Ongoing monitoring and appropriate management are required for Mr. Peter Dunbar, who was diagnosed with type 2 diabetes mellitus. The better sentences are in green. And the king of the sentence is this. Regular observation and necessary assistance are required for Mr. Peter Dunbar, comma, who was diagnosed with type 2 diabetes mellitus. Period. See the beauty of the sentence. See the mastery of the sentence. This is called proficiency. Not even Peter Dunbar. People will write, I am writing to refer Mr. Peter Dunbar, who was diagnosed with type 2 diabetes. He requires, oh, nonsense. Oh, my God, how many times I have told many people not to write like this. Huh? What is the purpose of the letter? What for you are writing? Are you writing for Peter Dunbar? No. You are writing for regular observation and necessary assistance. You are writing for ongoing monitoring in appropriate manner. This is more important. Okay. Right. Write your own sentence however you want. I want to give you many different, already ordinary sentences you can write those sentences. What you cannot write, I have to give you. Useless fellow, sir. Actually, I am a multiple test taker. I passed on my third attempt, all thanks to Mr. Rian. Indeed, he's a godsend. He doesn't know the spelling of God. Eh? He helps the students during the following exam. And this idiot says that he has passed OET. And he says, go to Mr. Rian, he will make you pass. He'll give you leak papers. Hello guys, finally I have passed my exams after falling 3 times. Failing spelling doesn't get, this idiot doesn't know what is the spelling of failing. A useless fellow, these fellows come and spoiling my, this is the reason why I don't allow anybody to write in my channel, first of all. Hello guys, finally I have passed my exam after failing. F-A-L-I-N, failing spelling, he doesn't know, idiot. Huh? And I don't know what type of teacher this fellow is. 3 times. All thanks to Mr. Rian for providing me with legit question and answers for my exam. I will recommend anyone who has difficulties in passing this exam to massage me for his contact if interested. These type of idiots, they say leak papers and our stupids, they run after them to buy these papers. Crazy nuts. And these fellows come and write everything in our channel. That's why I closed my channel. I was telling you in the beginning, these idiots only. See, 1 minute I was not bothering. I was serious in the lecture and somebody has come. And one fellow spoils and loses his money like this. Delete and then remove him from the group. And today what happened? Somebody idiot came, I don't know, and he's telling somebody as a, what is that, hacker came, a mobile hacked, it seems, useless fellow. Almost 50 people have gone out of the platform. What's up? Somebody told, and these people are mad to follow them. They don't know that it is Simon Sir's platform. Huh? And another person here, see? Ayush Gibson, Bumbi Rian. Huh? Don't fall prey to such idiots. Our platform is a wonderful platform. Many platforms, all these nonsense things will always be there. Okay, I will not allow such fellows to be there in our platform only. So it's a very safe platform. Just I was noticing that only when somebody posted here. Okay, very good. 15. Wow. Salute to all of you. Because of you, I am blessed. Okay. If I get ordinary students, was diagnosed is better, Lakshmi. So no more admissions for full-time course for nurses. So only writing corrections I'm giving you. Anybody is interested, you can come. Okay. Reading and listening admissions I'll give. Okay. Wonderful. See the activity. See the activity. Where in the world people will write like this? Wonderful. That's the reason why I love students like anything. Okay. So very good. That's the purpose. Very important thing. Regular observation and necessary assistance are required with Mr. Peter Dunbar. Are required for Mr. Peter Dunbar, comma, who was diagnosed, not is diagnosed. Is diagnosed means now. Means now, not even today, now. Means the time when you are telling. With type 2 diabetes mellitus in our health center. That all not needed. Important things are enough. Okay. Very good. Very good. Very good. Excellent. So next one. So the condition, moving to Centerville to live with his daughter. This is very important. That's why. Okay. So regular monitoring of what? Regular monitoring of his diabetes. And encourage compliance regarding medication and dietary regimen. Mr. Dunbar. Okay. Is being transferred. Thank you for seeing. I am referring, is being referred, whatever you want. So this is transferred. Okay. Transfer of care. The patient is not transferred. Is moving from one. The patient is not transferred from your hospital to another hospital. That's not transfer. The responsibility of ongoing management is transferred. The patient is not transferred. My responsibility, I am transferring to the other nurse. I am a nurse in this community clinic. And he is moving to another village. So my responsibility is being transferred to that. So he is being transferred into your care. Is being transferred, not referred. Is being transferred. Okay. So what type of letter it is? Okay. So this is not a referral letter. This is not a discharge letter. This is not a transfer letter. This is transfer of responsibility letter. This is not a referral letter. That means sending to a new person, unknown case, new person. Not referral letter, not transfer letter. Transfer letter from the village hospital to the super specialty hospital, or from the surgery to the ordinary ward. Transfer to the ward, or transfer to the care home, or transfer to the something else, post-operative ward, or some low-level hospital. So that is transfer. The next one, discharge. Discharge from hospital to home, or discharge from hospital to the nursing home or care home facility. These are the three types of straightforward actions. But here these are not that. The patient is not referred, the patient is not transferred, the patient is not discharged. The patient is already moving. So my responsibility, I am taking care of him till now. That care or that responsibility to take care of this patient is transferred from me to you. Okay. Right. Is being transferred for your into your care. Is being transferred into your care, not into your facility, into your care, personal care. Okay. So that's it. So now how you are writing like that? So now keeping these things in mind, come on, write one sentence. Improve your sentence. Improve your sentence. Make your introduction an awesome introduction. I'm giving you 30 seconds again. Mr. Previous sentences and this sentence. Moving to Centerville to live with his daughter. That's one. Okay. He requires regular monitoring of his diabetes and compliance regarding medication and dietary regimen. That is management. All these things are required. Come and write a second round, because we are moving into the main role, main course now. Main letter. This is very important. Let me see who are the students who are there. Let me note down. Elizabeth. Come on, you write, you do your work, I am doing my work. Vikas is there, very good. Smita, Sitara, Sharmili, Saranga, Sai, Sindura, Reena, Punita, Mobi Paul, Meera Manoj, Lithol, Kausar Jabin, Harpreet Kaur. Harpreet Kaur, this is for your quality, okay? Harpreet Kaur. Okay. One student, okay? 30,000 per month in a famous institute. Okay. Not happy. Right? Not happy. Dini, Linio, Bohloko, Diana Shiba, Blessing, Azubik, Elizabeth. All are regular students. Only the new students are Abhilasha. Hello, Abhilasha. Welcome to our platform. Say hi to your teacher if you are interested. Allow participants to unmute. So you can unmute, Abhilasha. Hello. Welcome to the platform.
Hello, sir. Good evening.
Hello, Abhilasha. Where are you from, Abhilasha?
Sir, I am from India, Haryana.
You are from India, Haryana.
Yes,
Haryana.
sir.
Okay. Which city in Haryana?
Sorry?
Which city or town in Haryana?
Sir, Panipat city in Haryana.
Panipat is a famous city. Wow, it's a battle is fought there. First battle, Mughal battle. First battle, which battle? The 3 battles are fought. Panipat.
Sir, 1526 first battle.
You know history also. I learned in my 7th grade. I remember even now.
Yes, sir.
And now one movie also has come which became a flop, it seems. I don't know whether it is flop or success. I don't know. Okay. So welcome to our platform. Are you happy with the style of teaching what I am doing, or you think that this is too much?
No, sir, I am satisfied.
Okay. So what you are expecting, are you able to get from here?
Sir, only writing things.
Okay.
And
so
other
now
this,
what I am saying is, this is writing now. There are many other things: listening, reading, writing, speaking, grammar,
yes, sir.
vocabulary. Everything is there. But
Than
today, regarding writing, are you getting what you are interested?
sorry, sir.
What you want, are you able to get here?
Yes, sir. I am hearing.
Okay, Fine, fine. Other students, you write your points, all your points, write the complete sentence, write to improve, improve. Variation, variation. Variety is the spice of
Sir,
life.
sir,
Okay.
one thing,
Yes, dear.
sir, I want discussion of reading of part A because it should be done in 15 minutes only. And sometimes 4 or 5 questions were remaining in the part A.
Okay, fine. You can contact me for that one. Okay, you can take subscription for reading, only reading
Yes,
if you want. Okay, we are discussing all those things every day, every time. Yesterday also
okay,
we
thank
have
you,
done
sir.
reading party like that one. You can discuss with me there if you want part B, because now today we are doing something writing, no? So let us not
Yes, sir.
disturb others. Correct, no? I'm very
Okay,
happy you are
thank you, sir.
interested. You shared your feelings. You are worried about your reading. I can understand. Okay, I'm not saying anything is wrong, but we'll discuss that one some other time.
Okay,
Okay,
sure, sir.
you can message me if you want. I'll give you my WhatsApp number. Do you have my WhatsApp number?
Yes, sir, I have your WhatsApp number.
Okay, the same number which you have there. Okay, so
Okay,
let me
thank
check
you,
for
sir.
other new students if anybody is there. So WhatsApp number is here. WhatsApp.me. So this is my WhatsApp number. If anybody wants, like Abhilasha, to contact me, you can contact me here. Okay, you can contact me for any requests. Right. Actually, we were giving full subscription, but now I stopped giving. Okay, from this month onwards. So
Okay, sir.
that I can, you can contact me there. Next one, who is new there? Amadi Jacinta. Jacinta, is this that Jacinta? Hello, Jacinta. Are you from North? Amadi Jacinta, welcome to our platform. Can you unmute and say hi? Can you introduce yourself if you don't mind? Okay, Amadi Jacinta is not able to unmute. Okay, no problem. We can understand. So, yeah, right. Smita, thank you for seeing Mr. Peter Dunbar, who was diagnosed with diabetes mellitus. Full stop. Then that is different and this is different. Okay, full stop you have to put. Ongoing monitoring and appropriate management are required for controlling his sugar levels from your facility. He is being moved. He is moving to another city. He is being moved. Nobody is moving him. This cannot be changed into passive. Okay, next one. So I did not ask her to go. Why did she go away, Amadi? Huh? So Vikas, hello Vikas, how are you? Tintu, hello Tintu. Hello Vikas.
Hello, sir.
Vikas, share your experience.
Sir, it was very useful and very good experience, and I learned too much from here.
Okay, welcome. Whenever I send a link, immediately jump into that. Okay.
Yes,
Yeah.
sir.
Tintu.
Yes, sir.
Yes, Tintu, share your experience. Tintu, which Tintu? Second
Today,
name,
my
please.
first experience, sir.
Huh?
Today, my first class with you, sir.
So you are the first class. Okay, tell me,
Yes.
how did you come to my class? How did you know about this class? What
With a
felt you
friend.
to come here?
Sir,
And
with
after coming here, did you break your head? Why did I come into this session, first of all?
actually, every day I searching, sir, your class and everything. And your notes also, everything. Every day I was searched, sir. So today I got an opportunity, so I joined.
Okay, very good, very good. What did you learn today?
Actually, today I got, sir, how to write the introduction section and how to approach. First of all, what all are the things we have to finding priority, that kind of things, and the basic things I can understand, sir.
Very good, very good. Thank you very much.
Thank you, sir.
Okay, fine, fine. So next one, Tiffy Tommy. Tiffy Tommy. Hello, Tiffy. Yeah, Tiffy, where are you from? Can you share your opinion? Come on, others write down. I'm giving you time to write. Come on, write down. Yeah, Tiffy Tommy. Yes, dear. Yeah, can you share your experience? What did you learn? How was the session?
Sir, I can't see your screen.
Huh? You can't see the screen. The central part of the screen, you can't see left and right, you can't see. That's okay because I have placed these things. But in the center, you can see, na? If you cannot see, you have to exit and join again.
Sorry,
Don't
can you hear me?
Yeah, I can hear you, Tiffy. Tiffy or Tiffy, what is your name?
It is Tife from Nigeria.
Oh, from
Tife.
Nigeria. My darling children, how are
Yeah.
you?
I'm fine. And you?
I'm awesome. Come on, tell me. How did you come to know about our sessions?
Okay, I actually joined through Telegram. So I saw the link to your class and I just feel like joining. So, and that
Okay.
was what I did. And so
I
far, I've
created
really
a group
enjoyed
for
the class.
Nigeria. You can join there and you can invite all your friends also.
Okay, sorry, sir, can I get the link?
Yes?
I said, can I get the link for the Nigerian students?
Okay. You can message me on WhatsApp, then I will send you there.
Okay, I will do that definitely.
Yes, yes. Okay, fine. So how did you find the session?
It has been so much interesting so far. I've learned so much. You taught us how to write much of our introduction letter. Then the particular things I learned from today was like when when the name of the patient is in the stop and when the name of the patient is not, what we should include and what we should exclude. Then I also learned you gave us like 4 tips of writing the OET letters. That is, the first one is we should avoid active words. Then we should avoid personalization. That is personal pronoun like she, he. Then we should avoid repetitions and we should avoid common words like words that Dick and Harry everyone are using. Then the last one is that we should not copy sentence, like we should not copy word from sentence. We should try and change the structure of the words and then write in a passive form and in a passive way. So I've really learned so much today. Thank you so much, sir.
Very good, very good. Thank you very much. Any new students are there? Right, very good, very good. Sitara has written blessing Temiled. Swati. Okay, Swati is new. Hello, Swati.
Hello, sir. Good evening, sir.
Swati, where are you from?
I'm from Hyderabad, sir.
From Hyderabad. Is this
Yes,
the
sir.
first time you have come to my platform?
For writing, yes, sir. I've attended a reading section earlier last week.
Okay, okay. I am from Hyderabad. Do you know that?
Yes, sir.
Oh, you know that also. Okay.
In
Fine, very good.
today's class, you just shared your experience.
Huh?
In today's class, you just mentioned that you're from Hyderabad, so yeah.
Okay, okay, fine, fine. Right. So what is your experience regarding today's session?
Yeah. So I'm just learning This is very new, the way you explain and the important points to be noted, what to avoid and all. It is very helpful in the actual test. I've already given my test, but I did not get the grades. So I'm looking forward to learn more from you. And this is very
Okay,
helpful.
okay. That's good. That's good. Thank you very much. And next one, Jubil.
Thank you, sir.
Yes, sir. Good evening, sir.
Good evening, Jubil. Can you share your experience?
Yes, it was wonderful, sir. I got information regarding how to write the introduction and all. So it was very helpful, sir. Really.
Okay.
I hope I
Right.
can do better in writing.
Good, good. Where are you from, Jubil?
I am from Kerala, sir.
Kerala. Okay. Lakshmi Nair from Kuwait. Huh? Hello, Lakshmi. Lakshmi Nair. Okay. Sharmili. Hello, Sharmili Ashanti. Sharmili Asanti.
Hello, sir. Good
Hello,
evening,
Sharmili.
sir.
How are you?
I'm fine.
Hope you are not angry. I took your name there.
No problems.
Okay. Tell me.
Yeah,
What
I'm
was your experience?
happy to join the class. And actually, this is the first time I'm facing for a class. I'm planning to do my exams on at the end of the September, and this is the first time I referred these things. So the tips and everything you had taught today is very useful, and I hope to improve my knowledge and do the best for the exams.
Yes. Okay. Thank you very much. And if anybody
Thank
is
you,
new,
sir.
then we'll talk later. Thank you. Right.
Hello.
Yes, Lakshmi.
Hi, sir. Good evening.
Yes, Lakshmi. How are you? Where are you from? Kuwait or Bahrain?
Bahrain, sir.
Bahrain. Okay. Tell me,
Yeah.
share your experience.
It is a nice experience, sir. Anyway, I'm preparing my self-study. It is very useful for me. Thank you, sir. Thank you so much. I appreciate it.
Okay, fine, fine. Yeah. Now I'm going to share you for all the new students, because there are many new students, only writing corrections. For regular students, all the full batch students, I'll correct 2 letters, 3 letters, and I'll give number of speaking sessions. But now I'm going to give you the subscription for writing subscription. Normally, writing subscription, the fees for writing is 5,000. You know that. So writing, so the fee for writing, only writing I'm giving now, because I'm closing the admissions for full course and I'm giving only writing. So writing subscription is 5,000. So whoever wants to take writing subscription, you can take. But now, if you are joining only tomorrow, you can pay 3,000 only for writing for 1 month. 3,000 for writing for 1 month, only writing. Only I'm giving only for tomorrow. After tomorrow, from tomorrow means from today midnight 10 o'clock till tomorrow midnight 10 o'clock, 12 o'clock. So 12 to 12, Indian Standard Time. So I'm giving only for 3,000, only writing. And all the full course is closed. So if anybody is interested in reading we have the reading course fees is 3,000 and listening course is 3,000. Okay, full course is stopped. So reading and listening together is 5,000. If anybody is interested, you can contact me. Right. Now coming to the point, we are moving forward. Yeah. Now here in paragraph 1, you will write the patient details, present problem, and purpose of the letter. Now here paragraph number 2. Now let us see paragraph number 2. These are the things that you write with paragraph number 2. Okay. So the most important problem is diabetic neuropathy. Okay. The most important problem is diabetic neuropathy. So this is paragraph number 3. Okay. These are the conditions. So what is the situation and everything? Percent condition. Right. And paragraph number 4. So you can see here secondary problem. Secondary problem. And paragraph number 5. Conclusion. Okay. Conclusion. Okay, now let us see here. Yes, this is the point. So now you can see paragraph number 3, paragraph, okay, number 4, and paragraph number 2 and paragraph number 3. Right. So this is relevant information. That means which information is important. Copy. What I'll do is save as. This is number 1. Number 2. One and 2. Combine files in Acrobat. Yeah. Now you can see a little bigger version. So this is relevant information. Save as. So this is Peter Dunbar, Mr. Peter Dunbar. Relevant information. Information and organization. So this also I am sending there. I am sending into the Telegram channel. You can take it from there. Yeah, there it is. Relevant information I have sent. So if you can just click on that one, you'll get here. So you can see. Now what are important, what are not important. The nurse, community health care center, moving to another city to live with his daughter. Paragraph 1. Peter Dunbar, date of birth, medication, metformin and ramipril. Okay. Then diagnosed with type 2 diabetes, August 2016. And now it is what? Okay, now it is the date of today. Okay. It is October 2018. Okay, you can see that. Right? Fine. September 2017, March 2018. Okay, June to August, and yeah, August 2018. After that, October 2018. So you are writing your letter in October. Okay, whatever it is. So the date, October ending, like that one, or November beginning, something like that. So here, now, so this is the most important problem. diabetic neuropathy. Okay, and he's walking with a stick. So you can observe that one. That goes into paragraph number 2, because this is the most important problem. Walking with a stick, signs of diabetic neuropathy. Okay. Then paragraph 3. Okay, the future strategies. What should he do in the future? Right. What should he do in the future? So, patient moving to Centerville to live with his daughter. Daughter will cook. Rested to dietary modification, misses double doses medication. All these things. Okay. The next one, paragraph number 4. Hospitalized. He got myocardial infarction, and in the same time, he was he was diagnosed with atrial fibrillation here, and he was commenced on sotalol and warfarin. This is the secondary problem. This is the first problem: diabetes and diabetic neuropathy. Diabetes and diabetic neuropathy. This is the most important problem. So you'll write about that one. Sure. Right. This is the diabetes. 2016, and now this is 2018. How can you use present perfect tense? How can you use present perfect tense? 2 years before. Be careful. Okay. Be careful what you are writing. Okay. Present tense means present tense. This is 2 years back. Okay. So was diagnosed. So next one. So this is now. Okay, currently. So serious problem, this is most important problem. So signs of diabetic neuropathy. All these things you can write. Then after this one, okay, write how this condition worsened. How this condition worsened. Okay. So this one. These are all the reasons. So now it is worse. Now it is this condition, diabetic neuropathy. And what are the background conditions for that one? So supporting paragraph. Okay. So because of all these things, his condition worsened. Okay, worsened condition. Right? This is the most important problem. And this most important problem is because of this worsening condition. Okay. And this is the secondary problem. Secondary problem is atrial fibrillation. And during the same admission, he was admitted, hospitalized. During the same admission, he was diagnosed with atrial fibrillation, and therefore post-myocardial infarction. In the hospital itself, he was diagnosed and he was commenced on sotalol and warfarin. Okay. Now, so I'm going to give you sentences. Come on. Okay. I'm going to give you sentences. Sentences. Now you are going to write sentences. So I gave you paragraph. How you have to write, which paragraph? You can take these notes and you can write. Now I want you to write sentences. Now what sentences? Diagnosis is over. Okay. The next one. Non-compliant with a diet. Okay. Consuming excessive fat, sugar, salt, etc. Okay. I will write those. I'll take those points from the case notes. Yeah. Here it is. Now let us take this one. So this sentence. Now write sentences. Okay. Daughter will cook and patient daughter will cook. Therefore, daughter requires education regarding patient's needs and monitoring. Okay. All right. Now you have to write with passive voice. What is more important word? Come on, shoot it down. What is the most important word? Daughter is important, cooking is important, requires is important, education is important, needs and monitoring are important. What is important here? Come on, write down. What is the most important word? Think and write down. Don't just to shoot like that. Come on. Yes, education is more important. Education is more important here. Right. So how are you going to write this sentence? Come on, write down. Appropriate education is required. Appropriate education concerning or relating or regarding the requirements and observation are required for the daughter because she has to prepare food and provide necessary assistance. So however you want to write, you write your own sentence. Try to write passive voice as far as possible. Come on. Write out the sentence, please. 3 or 4 sentences we'll write down now. Come on, write down the sentence. The necessary education concerning the requirements and supervision of Mr. Peter Dunbar is required for the daughter because okay. Dietary education on diabetic regime of Mr. Peter Dunbar are required by his daughter. Are required for his daughter, not by his daughter. For his daughter. Yes, very good, very good. Come on, come on. One sentence. Okay. And next one is so the next sentence is patient continues to require monitoring and encouragement. Remove patient. Patient continues to require monitoring and encouragement. Okay. Regular continuous observation not only but also necessary motivation are recommended. You write, you do your work, I am doing my work. You do your work, I am doing my work. Next sentence. You write your own style. I am writing, you change your words, you do whatever you want. Next one. Resumed medications, but still only taking intermittently. Resumed medications. Write down your sentences. You write your sentences, I'll write. I'm just giving you one sample sentence. You can learn the other sentences. So resumed medications. Medications are resumed. Medications are resumed. So resumed medications are resumed. That is the passive form. So like that, however you want, but still only taking intermittently. Okay, intermittently. Medications are resumed, but lacks medication compliance. But lacks medication compliance. Though medications are resumed, despite the resumption of medications, despite the resumption of medication, I'll teach you grammar some other time. Despite the resumption of medications, okay, non-compliance has been reported. Or you can say medications are resumed. Although medications are resumed, although medications are resumed, intermittent consumption, intermittent intake of intermittent compliance has been noticed or observed or mentioned. You can continue. Although medications are resumed, passive voice, or despite the resumption of medications. Okay, patient now walking with a stick. Can anybody write this sentence? Write a beautiful sentence. I want to say, wow. Annulation is possible with the assistance of a stick. Wow, wonderful, wonderful. Sitara Jetunga. Very good. Mobilization. Ambulation is already used. Mobilization is possible with the support of a walking stick. Mobilization is possible with the support of a walking stick. You write your own sentence. Okay. Can you now ready? Can you now submit your letter? Okay, after, okay, within one, okay, okay, in the next 1 hour. If you submit within the next 1 hour, you will get early morning or afternoon. If you submit in the tomorrow, then you will get day after tomorrow. Yes or no? Yes or no? Again, lot of information. In this heat only you write everything. Yes, Harpreet, you can collect them now. Because you gave them as a cluster, they missed 2 or 3. Okay, otherwise everything is done. So many corrections are there. Only those missed because they were in a cluster. 4 or 5 together they have been submitted. Yeah, you will get all of them today. Just remind me after 15 minutes after my dinner. Okay. Harpreet Kaur corrected. Maxim Gorky. So these are all letters corrected. I am going to post now. This is letter number 29, 829, already corrected. Okay. Just editing and posting. Enable editing. I'll edit and post. Already corrected. Very few mistakes, not too many mistakes. Good. Final stage. Good, very few mistakes. Wow. I have to convert it. Yeah. Already corrected. So, all of you can submit your letters. All of you can submit your letters. Thanks. Good night. Feedback, please. 3 sentences maximum. So write your feedback in 3 sentences. Write your feedback in 3 sentences. I already sent the case notes. Elizabeth, I'll send you again. Send in a message in the group. Yes. No, Harpreet, now I'll do with you speaking. I'm going to call for speaking sessions. All the regular students. Vijnana Jyoti, you can call me for speaking. You can message me. Okay. Right. Vijnana Jyoti, unmute. From the bottom. Okay. Linio, do you want to do the speaking session? Harpreet. Yeah, Vijnana
Yes, sir.
Jyoti. Yeah, you want to
Hello,
do the
sir.
speaking session?
Yes, sir.
So fine.
Hello.
I'm going to send the link and I'm going to take the speaking sessions. Okay.
Oh, okay, sir.
So whoever is interested, send me a personal message. Send me a
Yeah.
personal message in the, not personal message, group, mega group. Send me the message in the mega group. And I'll call you for speaking session. After lunch, after 15 minutes. After 15 minutes, sorry. Okay, that is the end of the show. Copy. Yes, good night.